video, I'm going to be going over with you guys what you should do if you recently failed your NCLEX exam. So if you failed your NCLEX-PN exam and you don't know what to do, then this video is going to be very helpful for you. So make sure that you stick to the very end and stay tuned. So my name is Nurse Choma. I am a registered nurse. I've been helping people to pass their NCLEX exam, especially those that have failed now since 2015. And I've helped hundreds, if not thousands of people now to pass their exam. And so I want to show you what you can do differently so to ensure that you pass it the next time, how to approach it, and I do also have a free guide for you. So below this video in the description, you can find a free guide, which is called my top 10 NCLEX mistakes to avoid. So even if you already have failed and taken the test, it will tell you what you should do differently moving forward with the next time. So let's get right into it and let's talk about what you should do, the step-by-step plan you should approach so you can pass this exam. The first and number one is to obviously breathe, relax, do kind of like a mind reset. Don't feel bad. It doesn't matter how many times you've taken it or how you may feel right now, as far as like maybe feeling discouraged, defeated, sad. Realize that it doesn't mean that you can't, become a nurse, and it doesn't reflect necessarily that, you don't have the capability of being a nurse, all right? So just relax and remember and remind yourself of that. Now, once you do that, now the next thing is to honestly do like an audit and to evaluate what worked and what didn't work. Try to reflect on some of the things that you did that you feel like helped you, and then some of the things that didn't help you. So, for example, a lot of my students that come to me and reach out to me to tell me that they haven't passed their exam, um, you know, and they're trying and they're seeking for help. So that's what happens is that they honestly were distracted. They had things going on in their personal life that made it hard for them to commit to studying, and they didn't give as much attention as they thought or realized that they needed to be successful. So maybe that's it. Maybe there was personal things in your life that was, getting in the way and was making it difficult for you to really focus and really be committed. Another thing as well is go back and rethink the test. So think about when you were taking the exam, were there specific questions that you kept on seeing over and over again? Because usually if there's questions that you were seeing a lot of, those are the questions that you were doing the most poorly in and that you need to go back and review. So for example, I've had students that will come back and they will say like, yeah, like when I took the test, I remember I was getting lots of chemotherapy questions, questions that have to do with cancer, or I was getting a lot of pediatric questions. So those type of questions, they all fall into a very specific type of category on the test. So if, for example, if you're getting a lot of pediatric questions or maternal health questions, that's health promotion and maintenance. If you're getting a lot of cancer or chemotherapeutic patients or questions, that could depend on what they were asking you, like the medication, that could fall under pharmacology, or it could fall under reduction of risk potential, right? So after you have to kind of retrace your steps a little bit, if you took the test recently, to think about what exactly were the questions you kept on seeing a lot over and over and over again, and then now begin to plan that into your studying, because that's probably the content that you need to devote a little bit more energy towards. So that's the first. That's one of the things as well. Another thing too is to review your CPR results. So your CPR results are pretty much the results that you get when you don't pass your exam. That will literally break down and tell you, below passing, near passing, above passing, all that type of stuff. It will say the number of questions you got on the test, and all the areas that you scored in. Now, I've had some students that were so emotional, about failing, that they threw away the test. They threw away the results as soon as they got it. And I tell them that's a terrible idea. Do not throw it away. I know it can be very humbling to look at it, and it's just like a reminder of like defeat almost. But you have to look at it because you need to see what are the areas that you did poorly in. You really need to see that. That's really, really important. So that's one of the things I would tell people is to go through your CPR results and pay more attention to the areas that you got below passing in versus the ones that you got near passing or above pass in. So the below passing ones, those are the ones that honestly need more attention, right? That need more attention than the other areas. And then the near passing or above passing, those ones that shows that you did pretty well in those areas. So it doesn't mean that you're not going to review them at all, but you want to obviously give more attention to the below passing ones. If you want, I do have a um, opportunity on our store where you can actually submit your CPR results for to be reviewed, or actually it will actually tell you what your results typically mean. That's available through the link in the description. Right. So those are some of the things. So the first thing you need to do is do like a full audit and like review everything. All right. So review everything and evaluate where you stand and what worked, what didn't work, and etc. And it does also help a lot to compare all your test results. So for example, I've had students that have taken the test 2, 3, 4, 5 times, not just once. So it's very important to compare all of them. So for example, if let's say you took, and this is the common thing I see, is that the first test they were near passing and they didn't pass. Then the second test they got like one below passing. Then the third time they got like a bunch of below passing. So you have to go back and evaluate what did you do to study each of those times. And the biggest problem I notice for a lot of people is that they completely change what they did each time versus focusing on what worked that gave them the highest score and doing more of that. So that's one of the things is that you should definitely compare all your tests if you took it more than one time. Now the second thing now is, and if let's say you have failed it and you just haven't gotten back around to doing it again, like let's say it's been 3 months, 5 months, a year, right? Then you're gonna definitely want to take some type of assessment test as soon as possible to evaluate what your percentage is today so you can see where you stand today. Then after that, then you're going to want to work on creating some type of study plan. So you want to give yourself adequate time, obviously not too long, but then not too little either, to start studying for the test again and start preparing for the test again. Now, I don't recommend, it depends on your state and it depends on your experience because I've had it before where some people where they apply to get the ATT score and then they schedule the test, but the problem is that the ATT score didn't give them enough time to study to prepare. So honestly, it's gonna really depend on your state. Some they'll get the ATT score and literally they'll have like a whole year, before it expires again. But then there's some it's like 3 months. So it really depends on your state before you go and schedule it again because you may not have enough room. Then, like I said, so now you create that study plan. The plan, when it comes to creating a plan, it should it should involve first at the beginning honing in on your weak areas. So focusing on those areas that you're the weakest in, and devoting anywhere from 1 to 3 weeks of studying those weak areas. And when I say weak areas, I typically mean if you took the test and the areas that you were below passing in. So studying those areas, reviewing the content. Sometimes, honestly speaking, it can, and this is just me being frank, it can be, especially if you got a lot of below past areas, it can be that you don't know the content as well as you think you do. Okay, and many times that all that can be revealed by taking a practice test that's comprehensive before taking the test again. So sometimes it may not be that you just don't know the content as well as you think you do, and you need um, to like hone it more into the content and better understand it. Sometimes it could be you just need to work on your critical thinking skills, right? So for whatever reason, when you see a question, like you know the content, but when you see a question, you're not identifying what it's asking you correctly. like you're coming to the wrong conclusion, and that's what was causing you to not do well when it comes to the test. So, like I said, so far we said the first thing you're going to do a mind reset, relax, breathe, encourage yourself, know that don't take it like it's impossible, but try to encourage yourself. Number two, do an audit, evaluate everything from your study habits to your any personal distractions, all the way to your CPR results, and see what worked, what didn't work, and what you should do differently moving forward. Then the next thing is now to create a plan, right? So create a study plan, which will be dependent on your state as far as the timing to go and get another ATT score in case it expired. But go ahead and create a plan, and you should definitely devote the first 1 to 3 weeks to definitely honing in and studying those areas that you're weak in specifically. Now, I have seen it sometimes where people honestly got near passing in all the areas, but the areas that they got below were more like the categories that's focuses on the NCLEX and next gen style, right? So being able to analyze cues, being able to evaluate that type of stuff. So those are the areas that some people do poorly in. And if that's the case, then the issue is going to be your test taking skills, the way that you're analyzing the question, or the way that you are coming up with the conclusion on what the question is asking you. That can be your issue as well. So create that plan, focusing on those weak areas and really honing on those areas. Anytime when you're reviewing content, you should definitely, of course, try to do questions, to do a few questions at the beginning of your plan, and then as you move along, then do more questions towards the end of your study plan. Which I mean, and when I say towards the end, I mean towards the time that you're getting ready to take your NCLEX again. So there's just there's it's just pretty much just creating a very simple routine. And what would definitely be helpful is to write all these things down. Anytime you take a test, practice test, assessment test, track it, write down, and so that way you can see the trend, see if you are going higher or lower when it comes to practice tests um, while you are studying. And if you notice that your scores are not improving, even though you're reviewing content, studying, doing things, etc., then it may be time to get additional help. And that may look like a tutor, that may look like a review class, that may look like a course, in order to really help you to better understand the material. Sometimes you just honestly have to just see things from a different point of view. you know I see this a lot for a lot of students that are repeat test takers. You took in the test so many times, or a number of times, and at a certain point it's just like everything just feels like it's the same. Like everything just feels so repetitive, and it just nothing is really translating anymore, and nothing is really, like you're not getting that aha breakthrough, like, oh, this makes sense. None of those experiences are happening, because it's just become so mundane with the studying. I've had students before who have told me, like, I've been in the library for 8 hours studying by myself, reading books, and I don't remember anything. And that's just essentially because of the approach is ineffective. So it's just honestly just getting that help that you need, so that way you can succeed. And so once again, that's why I recommend to go to the description below, and you can download for free my free ebook guide that I created for you, which is called "The Top 10 NCLEX Mistakes That You Must Avoid," and it will go through 10 different things you can do moving forward, so that way you can absolutely pass this exam. And you definitely want to do everything you can to be able to ensure that you pass. I do also have a 5-hour online review class. It's a 5-hour crash review class. This is a perfect opportunity for you if you feel like, you know what, I really need somebody to hold my hand. or I really need to see the content differently and understand it differently, and just begin to like get that accountability, then you're gonna definitely want to be a part of the 5-hour review class. In addition to the class, it does also include as well a course as well for you to review before the class even starts. You also get the replay from the class, the slides from the class, and then it could be a great opportunity to connect with other students in the class. If you want to learn more about the 5-hour review, once again, that's available below in the description or in the comments. Thank you for tuning in. Thank you for watching. Comment below. Let me know your story. I'm a first time test taker. I'm a second time test taker. I would love to hear from you. Thank you for tuning in. Make sure you hit the like, subscribe button, and I'll see you guys the next time.